Hey again, everybody. This is going to be our first introduction to medical sociology, just from a very high level today about what actually is medical sociology. Going to reference some of the readings, but what actually is medical sociology. And then we're going to talk about research methods, because I think it's also really important just to give a high level overview of research methods. Um, we'll talk about why as well. But so before we get into the introduction to medical sociology, I also want to talk about what is your role in this class, right? What is your role as a student in this course? We talked a little bit about it, I guess, in the introduction, but also wanted just as a reminder. So readings, right? You are tasked with reading the assigned readings. What I'm going to do in the lecture recordings is we're going to go over some high level components of the readings, but you will dive into reading the actual assignments and the actual readings and watching the components. So we're not going to go word for word or beat for beat in all of the readings. We're going to give a high level components of it. So then it's your task every week in the discussion prompts to then apply all the things from the lecture recordings as well as from what you have actually read to then your discussion prompts. And that's going to make more sense as you're actually synthesizing what you've learned and adding to your discussion prompt. Okay, hopefully that clears some things up. Let's talk a little bit about medical sociology. So what actually is medical sociology? So this really comes from our textbook, our Barkin Chapter 1 reading. I really want you to familiarize yourself with the scope and the focus of medical sociology. So let's define medical sociology, right? What actually is it? So medical sociology examines how social factors affect health, how social factors affect illness and medical institutions. So please, I really encourage you to think about how your own social identity, whether that's race, class, gender, age, might influence your health experiences. So these are the things we're looking at about how is medicine, how are our experiences of illness and health impacted by the social world around us, not just by individual actions or individual experiences. So we'll look at things in this class about multidisciplinary nature. Look at sociology, look at public health, look at medicine, but also examining how these social structures like race, class, and gender, and then how social institutions like the economy, like government, like family, impact health outcomes. That's why we started in the first recording here of the class to talk about some key elements in sociology, because we have to understand those to then understand where we're going in this class. So again, medical sociology is that distinct field, right? It's a subset, but a distinct field in sociology. And we look at also the difference between illness and disease. That's going to be a really prominent factor. That's going to be a prominent theme of what is the difference between illness and disease. So illness being your subjective experience, okay? So my experience as having an illness, or disease, your objective biological condition. So disease is that biological condition. The illness is the more subjective social experience of having that disease. That'll become more clear as we get through this. And then we're also going to talk about some of these key sociological theories in health throughout the course. So I mentioned functionalism, right? Looking at how maybe the industry, how society functions in relation to health. Conflict theory, looking at who has maybe the unequal distribution of healthcare resources across things like race, gender, age, other social factors and groups. And then symbolic interactionism. How do we understand the medical world around us, right? There's so many different symbols, terminologies specific to certain cultures. How do we understand in our culture the medical world? How do we understand this? How do we traverse it? These are the things we're going to look into. So just as a quick summary too of the reading of chapter 1 of Barkin. So Barkin's chapter introduces you all to some key concepts in medical sociology. He also writes about how he explains that health is shaped not only by biology, but also social environments. The reading outlines how medical sociology emerged as a discipline, right? Stressing the role in analyzing, stressing medical sociology's really important role in analyzing healthcare systems, analyzing medical professionals, analyzing social inequalities in health. That chapter 1, health, illness, and society, provides that kind of accessible introduction to medical sociology, but also discussed, right, social determinants of health, the sociology of illness, and the organization of healthcare. So key terms like social determinants of health, illness, behavior, medicalization. Make sure you go back and discuss those, or take a look at those, because we're going to discuss all of those in the rest of the class. We're going to look at each of these things individually. Some key concepts of medical sociology. So health as a social construct. So what do we mean by a social construct? We're not saying that when we say social construct, one of the things that often gets confused is that people assume that we mean that it's not real. That's not what we mean by a social construct. It can be a very real lived experience, but that it is socially constructed. So look at how, when you think of health as a social construct, think about how different societies define health and illness, right? How does United States society define health and illness versus, say, Japanese society define health and illness? The social determinants of health as well. So we need to emphasize how income, education, and environment are key factors in influencing health disparities. That folks with higher social class, with more income, with more education, that these folks oftentimes have greater healthcare outcomes, greater health-related outcomes because of access to healthcare, access to quality and affordable healthcare. These are really important to look at in medical sociology. When we look at these differences, right, we're going to look at how these the distribution of resources, how does that impact people's lived experiences? It's really, really important to look at these things. This is the primary feature. If you get one thing out of this semester, it's how do we look at the social determinants of health, and how do we impact that and apply that to the real world? If you're going to be a healthcare professional someday, if you're going to be a doctor, a nurse, whatever it might be, make sure that we're understanding how people's lived experiences based upon these social factors, that they actually have a very real impact. Medicalization is another term that was discussed in the reading. So medicalization is the process of defining non-medical issues in medical terms. So think of aging, childbirth. These are some examples that are used in the reading, but how do we define non-medical issues in medical terms, right? So with the medicalization of our society, and how that's shaped by things like the economy, by our social institutions, that we tend to medicalize things. What might be the reasons for that? Why do we medicalize things? We'll talk about that in very soon, actually, in the coming week or two. And then illness versus disease. So illness, like kind of what I mentioned in the first slide, is the human experience of disease. So illness is an explicitly social phenomenon with both an objective and a subjective reality. So illness is your social experience. Disease is the objective reality of an ailment. So let's say you have cancer, that is your disease. Illness is your social experience around having cancer. And they look very different, right? Those things look very, very different. So the Hicken 2018 reading, just want to discuss a little bit. So, and just to give you a summary here. So what this paper does is it examines how racial inequalities in health, it examines those things in particular and frames potential future research directions of all of those. So what the reading does, it also highlights the need for a comprehensive research framework that accounts for how racism actually impacts health through both direct and indirect pathways. So think about those pathways that they discussed in the readings, right? So looking at how racism impacts health through those different direct and indirect pathways. Those direct pathways being discrimination, right? You walk into an office, a healthcare office, and there could be direct racial discrimination with healthcare professionals. But there's also indirect pathways, socioeconomic status, neighborhood segregation, and that contribute to inaccess of resources or diverse perspectives on medical issues. Those things are the more indirect pathways of racism that can impact health outcome. And really these authors suggest expanding our research in medical sociology to better understand the cumulative health effects of systematic racism. So the reason why I started with this reading, because it gives us a good introduction into understanding the social world, how social identity can impact and have these different pathways of impacting our health outcomes. And you could apply the same framework, right? We have to understand how both systematic racism, systematic sexism, how these things impact through these different direct and indirect pathways our health-related outcomes. That is something that medical sociology looks very heavily into. So think about that from a gender or sexuality or race, age, income, socioeconomic status perspective. take the same framework that these authors do for race and apply it to those foundations as well to understand what are our different direct and indirect pathways that are impacting our health outcomes. Another couple of key points I wanted to mention too. Structural and systematic racism has key impact on health outcomes, right? That's just an overall key point there. Racial disparities in life expectancy, right? Infant mortality, chronic diseases. These are the outcomes that we're referring to. So when we talk about how systematic racism impacts direct and indirect pathways, these are some of the outcomes that we're talking about. So disparities in life expectancy, disparities in infant mortality, and disparities in chronic diseases. And then I also want to emphasize the importance of intersectionality. I mentioned that in the previous recording. Remember how overlapping social identities like race, gender, sexuality, age, socioeconomic status, these things intersect to shape our health experiences. It's not just race. It's not just gender. It's not just age. It's not just sexuality. It's not just socioeconomic status. It's all of these things and more overlapping and how it's so nuanced. So we think of our healthcare outcomes. It's very, very nuanced and complicated, but that's what we look at in medical sociology, are the intersection of these things and how these social determinants shape our health outcomes. And then when we understand that, we're then better able to address public and population health issues and improve healthcare outcomes. So I have some key discussion questions that you'll see in the notes, and I want you to be thinking about these things. Think about how racism manifests in healthcare, and what are some long-term solutions for addressing these inequalities. Think about how do social structures perpetuate racial health disparities. And then also with this reading, think about ways to address racial inequalities in healthcare through policy and intervention. Think about all these things and more. And how these all of these discussion questions throughout the rest of the day. Medical sociology's evolving subfields. So this reading also looked at just what it says there, some subfields of medical sociology. So medical sociology has evolved, right? In the reading, in the Hill reading, they discussed this. Medical sociology now really includes a lot of specialized areas such as mental health, bioethics, the study of medical technology, right? Think about all those things, how the conversation around mental health have increased more and more, especially in your generation, that we're talking about mental health more. The same thing's happening in medical sociology, the influence of culture on that, how the medical sociology is talking more and more about about mental health, also bioethics, and how medical technology, just like technology and culture, has evolved so greatly. We're looking at the same things about the evolution of medical technology. Changing societal issues have also driven these subfields. So things like the opioid crisis, we'll surely talk more and more at great length about. Mental health awareness, the rise of digital health technologies, telehealth, such as during COVID, went on the rise so greatly. These things have influenced the medical sociology and our evolving subfields here. And so really, I encourage you to look at current events like the COVID-19 pandemic, how that influenced future research in medical sociology, how that has influenced not just medical sociology, but how our healthcare experience has changed because of that. Things like telehealth, right? That we can jump on a Zoom call like this for a medical appointment. That just wasn't as readily available nor accepted before things like COVID. And that's what it takes. And that's Sociology 101 too, is that great social change can happen in different ways. Social change can happen in very gradual ways, or it can happen with very significant and very quick changes. Things like world wars or pandemics can influence social change very specifically in our communities. And so just a quick summary of this reading as well that I wanted to go over. So this is a chapter from a companion piece to a medical sociology book, and it really outlined the major shifts in these subfields, like we just mentioned. But early research in medical sociology focused on illness behavior, focused on doctor-patient interactions and health institutions. Today, though, these new subfields that were talked about in the reading explore mental health stigma, pharmaceuticalization, the impact of new technologies in medicine, and how this is just creating more and more and more. Another key subfield of the subfield in modern medical sociology is the look at how AI, artificial intelligence, is impacting healthcare outcomes and our experience with healthcare. I really encourage you to think critically about the future of the field, about the future of all of this, and how it's shaped by emerging health crises. Again, think about like the COVID pandemic. Again, this chapter also explores how medical sociology has developed all these multiple subfields and these different methodologies of looking at these things. The chapter highlights both quantitative methods like surveys, epidemiological studies, and qualitative methods like interviews, ethnography. We're actually going to talk more about that in just the coming slides. We're going to talk specifically about sociological research methods. And we use these same methods in medical sociology. So again, also the article emphasized the importance of interdisciplinary collaboration. So our collaboration between one discipline versus another discipline, right? Our collaboration between biology in medicine and sociology, psychology and mental health studies, all these things and more are really critical in how we examine medical sociology. And that's what this recording looked at, or that's what this article looked at. So, additionally, just a quick overview of medical sociology. Again, a couple quick points. Medical sociology examines the relationship between society and health. We've covered that, right? Focusing on how social structures, relationship, and contexts influence health, illness, and healthcare. Traditionally, medical sociology is a field that is concentrated on those topics, like I mentioned, right? What illness behavior is, doctor-patient relationships, social determinants of health, and healthcare systems. Some other key points from the reading is just, I just want to point out again, the historical roots of medical sociology and then the shift to these new subfields. That's what we looked at, is that we're constantly evolving in sociology and medical sociology. All right, and then some of these evolving subfields just continued want to take a look at looking at global health. Okay, just to start. So the focus on global health is our these cross-national studies of health disparities, infectious diseases, global pandemics. Again, think of COVID-19, how prevalent in a kind of post-COVID world it is to be taking this course. And then, of course, healthcare access in different nations. So the emphasis is on the sociological implications of international health organizations, global capitalism, resource distribution. That's a part of this subfield of global health. So an example would be how we analyze globalization and the effects of globalization on the spread of diseases and the access to treatments. Why did COVID-19 spread the way it did? Because of our increased globalized world. Social epidemiology. So this intersects sociology and public health by focusing on the social determinants of health. Think of poverty, education, housing as more examples here. Here we're exploring patterns and distributions of health and illness across populations. What certain populations are impacted or experience specific diseases or illnesses more or less. Example here would be research on racial disparities in chronic illnesses like diabetes. And why are there racial disparities in terms of diabetes? And for quick reference here, epidemiology, if you've never heard that term before, is the study of how diseases and other health issues spread in our controlled population. So it's a branch of public health that uses the scientific and systematic and data-driven methods to understand a lot of these things. So again, social epidemiology, we're going to understand the causes and risk factors of diseases and other health issues. We're going to determine how to prevent and control the spread of diseases and other health issues, monitor health status of a population, develop new medical treatments and disease preventions, provide evidence to support healthcare and policy decisions. So think about that being epidemiology. And the social piece here, the social epidemiology, we're looking at the social determinants of health along with that, right? Where are our distributions of illness and health experiences? Why do certain racial groups experience these illnesses or diseases more or less than others? Things like that. Digital health and technology. So we're investigating how technological advancements impact health behaviors, medical practices, and access to healthcare. So think about certain technological advancements like telemedicine, wearable health devices. These are those things we're looking at how this actually impacts our health behaviors, our practices, and our overall care. This also critiques the role of technology in exacerbating certain health inequalities. How has technology not actually both positively and negatively influenced health outcomes in society? Genetics and genomics. So here's a sociological examination of genetic testing, of gene editing, personalized medicine. There's a really great book called Codebreaker. But I believe it's Walter Isaacson, perhaps. I'll double check on that. But a potential great read maybe after this course or throughout it if you're into you want to learn more about genetics and genomics. And there's a lot of ethical conversations in this field, right? The ethical and social debates surrounding genetic determinism and inequality. Public perceptions of CRISPR technology. If you've heard of CRISPR, that's the Codebreaker book I mentioned. Those are the things that we're looking at here as a part of medical sociology. We're not just looking at the biological impacts, but also the social impacts, the cultural changes, the ethics around this. Intersectionality in health. I mentioned this already, right? Of how the intersection of race, gender, sexuality, socioeconomic status, how this intersection shapes health outcomes. Here we're also bringing attention to marginalized populations and systematic inequities. So how racism and sexism collectively influence maternal mortality rates. Things like that are really important to look at. This is what we're looking at in medical sociology. And then finally, environmental health sociology. So here we're linking, we're looking at the links between environmental factors like pollution and climate change on health outcomes. So environmental racism, maybe you've heard of before. That's another key component of environmental health policy. So looking through a sociological lens at environmental justice and activism. So maybe an example of what we would look at like community health outcomes in areas near toxic waste sites and how oftentimes those communities that are near these sites are less wealthy and communities in poverty. So we're looking at these socioeconomic and racial health disparities there. So just a couple of conclusions too. Again, the dynamic component of medical sociology reflects the adaptability of medical sociology and how we need to adapt to societal needs. This expansion into new subfields is really, really important. It illustrates our fields, the medical sociology's relevance and ability to address really contemporary and future health challenges. So we're looking forward in medical sociology. We're not just looking at the here now, but we got to adapt with how the world is changing around us. So think about how in a post-COVID world and these sorts of things, how we are adapting, how we need to adapt further. All right, so quick research methods here in sociology. I think it's really important to understand our research methods because we have to be able to discern what is good foundational research methods and what's not. And maybe some of you, this is going to be, you've already taken a research methods course, maybe even from me at Concordia, but I think it's important to just talk a little bit about these as a foundational component. When you're doing your own research, how do you discern what's a good study or what's not? And again, you can refer back to the notes at any time as they're obviously uploaded on the Moodle page. So how do we search for answers? So scientific method. So the scientific method is if you've never heard of it before, I'm sure you have, but the scientific method is a systematic and empirical approach we use to investigate certain phenomena, to acquire new knowledge, to correct and integrate previous knowledge. It's characterized by a series of steps that we'll go through in the next slide. And the sociological research really involves the systematic study of social behaviors in this same way. So sociological research takes the scientific method, adopts it to our methodology as well. So the scientific method. I won't go through all these in deep analysis. You can see them on the notes again. But once again, it is the systematic and empirical approach we use to investigate phenomena. Think about this through a sociological lens, social phenomena. So we start with observation. We make observation about a specific set of phenomena. This could be about the natural world. This could be about the social world. We have a question, right? Based on our observations, what is a question or a problem area we want to be identified? Or we want to look at it to be investigated, look into further. Hypothesis. So a hypothesis is a tentative explanation or prediction that we're going to test through our investigation. So if my observation is that, you know, there are racial health disparities that we're seeing. Oh, seem to be racial health disparities. Question is maybe why are those the case? And hypothesis would be me saying, well, I think this is why that these things are appearing, and that's what we're going to test in our experiment. So in our experiment, in a traditional scientific method, right, you can have your control group, your experimental group, your different variables. So the variables are the things you're looking at in your study. Your experimental group is the group that's maybe receiving treatment or a condition that's being tested, and a control group is a group in an experiment that does not receive that experimental treatment, right? Used as a baseline in your experiment. Now, this is going to be a little bit different when we talk about the sociological methods here. But then data collection. So during, say, an experiment or a study, you're collecting that data systematically, right? The data, you have to ensure that it's accurate, that it's reliable, it's precisely recorded. That's why we take things like research methods courses. Analysis. So you're going to actually analyze that data, whether it's through statistical, quantitative methods, like was talked about in the reading, or qualitative methods that was also talked about in the reading, right? There's quantitative and qualitative types of data collection and analysis. Then you draw your conclusions, if whether your hypothesis, your prediction is supported, or whether it's not. It needs to be rejected or revised. You publish. Report and publish your data. So this is maybe the most critical, well, I shouldn't say the most, but one of the most critical components of the scientific method is that when we find information, we publish and communicate our findings through reports, through articles, presentations. And the reason for that is we allow peer review. We say, here's our findings. Now, other scientists replicate that, review it, build upon this work, critique this work. That's how we get to a scientific understanding of the world around us. Then replication, where we repeat this process and we develop theories over time based upon the data that we've learned. Now, sociological research is going to see some similarities, right? Because we're rooted in the scientific method. But there's some specifics to sociological research. And again, this is the systematic study of social behaviors, patterns, institutions, and functions. We aim to understand how societies operate. All the things that we talked about in the previous recording, and this translates into also the things we just mentioned in kind of our medical sociology introduction. So some main components here. So you start with your research question, right? You identify a problem. What's a question that you have? Your literature review. Researchers review our existing studies. What's already been done on this area of research? What maybe is missing or what I didn't know that was there? Identify gaps or inconsistencies that your research can address. Your hypothesis or your formulation on theory. So based upon that literature review that you do, researchers are going to develop a hypothesis. Again, your attestable prediction, or maybe in some cases, especially in qualitative research, maybe you're developing a new theory or testing existing theories. Research design, so there can be qualitative, quantitative, and even mixed methods approaches. So this involves here is how you're setting about how you're going to collect and analyze your data. So qualitative methods. So these methods focus on understanding the meaning and experiences of participants. So this is like interviews, focus groups, those sorts of things. And these are typically going to be smaller, non-random samples, aimed more for depth and understanding, not generalization. Whereas quantitative methods, this involves the collection and analysis of numerical data or quantifying certain data. And techniques include things like surveys, experiments, secondary data analyses, content analysis of things like healthcare data. Quantitative research oftentimes is going to include those larger, broad-scale random samples, aiming more for statistical significance and generalizability. And mixed methods is just combining both of these to have a more comprehensive understanding. And so then, of course, you're going to gather your data. I just mentioned before what that goes into in terms of qualitative or quantitative methods. And then you're going to analyze it. So quantitative, right? Do the statistical analyses, qualitative, coding, qualitative data through interviews, focus groups, that sort of thing. And then all the same sort of before, right? Your findings, your interpretation, your conclusion, your reporting out that information, disseminating out your ethical considerations. Make sure that when we're dealing with people, we adhere to ethical guidelines. And that's the same goes for medical sociology, of course, and then replication and validation of our studies. So you're probably like, why are we talking about research methods and why are we going through so quickly? Because we have to understand that medical sociology is a social science and we're deeply rooted in our sociological research methods because we're looking at healthcare outcomes, but we have to do so in an empirical way. We have to know that we're having good data, and we get good data by sound research methods that we're going to employ, like these, that you can refer back to when you're looking through studies, right? Refer back to, is this a sound study? Has it been critiqued? Has it been peer reviewed? These are really important things. In social research, so what do we mean by, because we're rooted in this, right? We're not in medical research, we're in social research. So what do we mean by social research? It means that our knowledge of the social world is limited to our immediate and limited life experiences. We need an empirical framework then to better understand and more accurately and effectively understand our world, our society, our group. So when we talk about social research, we're looking at the social world. We're examining the social world around us. And we're looking at both subjective and objective knowledge, right? Objective, what is the hard-nosed data that we can, beyond a doubt, know that this is the case? Subjective data, how do we interpret the data? How do people interpret their lived experiences? And you think of what does the social world encompass, right? Social world encompasses society, culture, politics, organizations, schools, teams, classes, all these things that you can think of that you're in this world we're looking at. And levels of society. So we're looking at different levels of society. And this is really important because we'll talk about this from a medical sociology perspective as well. So we look at society from the macro to the micro to the meso. So in sociology, the macro level focuses on large-scale social structures and institutions, things like the economy, political systems, culture, how they examining how they shape society as a whole. So this is really broad, high-level things. Now, skipping down to the micro level, this centers on individuals and small group interactions. So exploring how personal relationships and day-to-day social interactions shape social realities, your individual experiences. And the meso level is in between those. That bridges the micro and macro level. So this is how we're looking at organizations, communities, groups, and subgroups, analyzing how these intermediaries influence and are influenced by both looking at the micro and macro level. So you have these three levels of sociology that we'll look at and look at how think from a medical sociology perspective, right? Your individual medical experiences at the micro level, your meso, your interaction with healthcare organizations at clinics, those sorts of things. And then macro, our healthcare industry within institutions like our economy, how family and these sorts and politics and culture shape the medical world around us. Again, we already talked about this, right? Subjective versus objective data, but what makes data objective versus objective? So subjective data is knowledge based purely on the opinions of the individual, reflecting their values and biases, their point of view, while objective data is knowledge which is free of those biases, right? From the opinions and values of the researcher, reflects what's really out there in the social world. So we want to make sure that we're aiming towards that objective knowledge, understanding what is actually occurring so we can get to a more actionable state to make that sort of change. Research design. So research design is the framework of research methods and techniques chosen by a researcher to conduct a study. So it's how you're going about answering a question. This is my research question, my research design is going to be how I'm actually going about doing answering my question. How am I going to collect data, analyze it, disseminate it, all those sorts of things. This includes, our different types of research design, like quantitative, qualitative, mixed methods approach. Are you going to do a case study? You're going to do an experiment. All these things go into research design. And it has to be suitable for the question you're trying to answer. And sound research design is so critical. And so this is what sound research design goes into sound research design. So you're identifying a research problem clearly and justifying its selection. You're reviewing previously published literature. You're clearly specific and explicitly specifying your hypotheses and research questions that are central to your problem area. And then you're also effectively describing the data, which will be necessary for an adequate test of the hypotheses. And then you're also describing the methods of analysis, which will be applied. So think about all that is, right? You're just not just deciding about how you're going to go about this, but you're very well describing it. And we go way more into detail in our research methods and statistics course here. But I think it's important just to emphasize here as well, as when we are looking at our studies, when you're looking at how some of your projects and your papers, that sound research design is just an important framework just to have in the back of your head, to know that this is really important in a scientific study. There's some different types of research design. I'm not going to go over these here, but look into the notes. And if you ever are curious, what are these different types of research design? Here's what they are. And you can look in the notes for descriptions of each of these. I just want to highlight cross-sectional and longitudinal though, because cross-sectional and longitudinal research is kind of more broad. So a cross-sectional study is I'm looking at, say, if I'm looking at this class and I surveyed and interviewed this class here and now at this point in time and wrote an article about that and published my findings. A longitudinal study could be if I looked at this class and interviewed the same people that you all at the beginning of class, at the end of class, and then for 10 more years at the same time, 10 more years, that would be longitudinal because I'm looking at you and I'm studying you across time. So in medical sociology, we're going to have both. We're going to have cross-sectional data. We're also going to look at longitudinal data as well. Primary versus secondary research. So primary research is like you conducting it firsthand, like you're doing that survey, you're doing those interviews. That's your original firsthand research. Whereas secondary research is you're gathering information from other or maybe previous sources and analyzing, interpreting their different, maybe often doing a little bit of different. So like literature review is an example. Let's say, if I did a survey and I did some statistical analyses on it, but you looked at that data and said, oh, I want to do these analyses as well, or take a different angle or approach. That would be an example of secondary research. Academic research is oftentimes a synthesis of the two, right? Looking at prior research, but then also building upon it with some original data collection. All right, quantitative versus qualitative analysis. So all I want you to think about here is be able to identify the differences. And what quantitative research is that numerical data. So think about quantitative in your traditional math, your computations, your statistics. It's numerical data, whereas qualitative data is focusing a little bit more on the meanings and understanding experiences of participants. So in non-numerical data, think of interviews, focus groups. You can imagine the difference between the two, right? You have specific survey questions, a scale of agree to disagree about something, or your satisfaction ratings on maybe a course. That's going to be your quantitative research. Whereas qualitative is going to be, I'm going to sit down with you for a half hour and interview about your experience. We can go down different tracks and get more and more specific. That's what I mean by the difference between quantitative and qualitative. All right, so why are we talking about research design? Again, it is really incredibly important, not just as sociologists or researchers, but as students, professionals, everyone to be able to look at the world around us, the information we are provided, the research or articles or books we read, what politicians or leaders are telling us to look critically at this information from a critical lens. It's really important to understand how do we get good data? What is good data? What is not good data? And then let's talk about that in terms of medical sociology. So in the Hill reading, talked a little bit about research methods and the interdisciplinary nature of methods. But really, this reading, the Hill, the 2021 reading, explored how medical sociology has developed its subfields, right? We talked about the subfields, but also highlighted those different research methods, both the quantitative and the qualitative side. And what I just wanted to highlight here, and they mentioned epidemiological studies too, which is are data-driven studies that examine the distribution and causes of health-related events in specific populations, right? So we do that through both quantitative and qualitative lenses. But just as an introduction to research methods in medical sociology employs a lot of diverse methodologies. So those and more that we talked about just in the previous few slides to investigate these complex relationships between social structures, health behaviors, healthcare systems. These methods are used to align with medical sociology's focus on capturing both individual and systematic factors that influence health outcomes. What are your individual experiences, and also what are those systematic components as well? And then just another couple key points, that interdisciplinary nature, right? So we use medical sociology blends sociological and public health approaches. So we leverage qualitative, quantitative, and mixed methods and different disciplines. So looking at medicine, looking at public health, looking at social work, and looking at sociological lenses all together. And we adapt these methods to explore all these different things like health disparities, healthcare access, medical decision making. It's really important to have a broad set of perspectives and a broad interdisciplinary approach in these components. And so I already kind of mentioned these two, and you can look at the specific strengths and limitations. We already discussed this though, right? Quantitative and qualitative methods and mixed methods in medical sociology in particular. But think about some applications of this, right? Quantitative methods in medical sociology. So national health surveys, administrative data sets, epidemiological studies. So here we can identify links between things like socioeconomic status and chronic illness, mapping out racial disparities and access to preventative care, for example. Qualitative methods, examples, investigating how cultural beliefs influence health-seeking behaviors or understanding stigma in mental health care. So through interviews and observations and focus groups, we can examine these things more and more. And then obviously mixed methods where we're just combining each of these together. Some innovative and emerging methods, just a couple of last quick things to mention on this. Social network analysis. So these are emerging methods and innovative methods in medical sociology. And this is where medical sociologists are studying the influence of social connections on health behaviors and outcomes. So an example of this would be analyzing how our peer networks, our friend networks, impact like smoking efforts or smoking. How do we stop smoking? Looking at support networks, how that impacts that. Digital and big data. So this is where we're leveraging electronic health records, social media, wearable device data. We have more data than we ever had before, and that's increasing because we have things like electronic health records and social media and these wearable devices, right? Like even like an Apple Watch is an example of that. So we have more data and more access to data. So we're looking at them in different ways. So an example would be monitoring health trends via social media during things like COVID pandemic. So looking at vaccine uptakes and how maybe public discourse on social media impacted that. See, participatory action research, PAR. This engages communities in the research process to address health inequity. So an example would be partnering with marginalized groups to co-develop interventions of food deserts. So instead of just a group coming in and said, here's the intervention, here's how we're going to fix this, we actually involve the community that needs to be impacted, the marginalized community, the impacted community in developing more effective solutions. Just some critical considerations in research methods. So just a couple of basic ones here. So number one, ethics, right? That we have to protect participants' confidentiality, anonymity, make sure that we're doing no harm. Equity, inclusion, make sure that we're having diversity in our study samples, that we accurately reflect populations that we're studying, avoiding biases in data collection and interpretation, and then translational research. So bridging the gap between academic findings and practical applications in public health or policy. So make sure that the data that we're finding, how do we bridge the connection? So we learn something new, how do we actually make that impacts? All right, so that's a lot of information that we went through today, about 40 minutes worth of research methods and an introduction to medical sociology. We're going to talk more about high-level ideas and actually specifics about about medical sociology, but I wanted to provide this foundation of the research method side because we are an empirical research-focused class. This is a scientific discipline. So I wanted to make sure that we had some sort of foundation in research methods. Last thing I wanted to mention today, reminder that we have our weekly Moodle prompt reflection starting. Make sure to complete your reflection. You can find that link on the Moodle page at the bottom of the Moodle page in the course reflection. There's one for this week, which is week 2. And then make sure to respond to at least one other student's discussion prompt. But that's all I've got for today. All right, we will see you next time. And thanks very much. And let me know of any questions at all that you do have.